Okay. Everybody, we're just going to give you a few minutes to kind of get settled and let some people join in. We'll probably start here in maybe 2 or 3 minutes. Okay. Everybody, we're just going to give you a few minutes to kind of get settled and let some people join in. We'll probably start here in maybe 2 or 3 minutes.
A big hello to everybody. I am super excited. Shout out to the person at work right now. Oh, my pleasure. So I have you guys also on my phone, so I'm able to see comments. So as I'm going through this whole thing, I'll try to kind of look back and forth in case you all have questions. I'm going to do the best I can. I'm not tech savvy. Also, disclaimer, I had to switch laptops, so the format of this PowerPoint, if it looks ugly, it's because this wasn't the initial laptop I made this on.
Okay, it is 5:06. I guess we'll go ahead and get started. First of all, of course, as always, thank you guys so much for devoting your afternoon, your night, wherever you may be, whatever time it is, for just to hang out with us. We love the community. You guys are awesome. Everybody's so helpful. You know, it's not like one of those everybody against each other competition type things. We love the teamwork. We love you guys sharing your experiences. So please feel free to be as active as you like in the chat. Leanna had mentioned that she's actually looking at the chat as she goes. So feel free and interact with her as much as you can. Comments, questions, anything like that. If there's a lot of questions, we keep an eye on them as well, and we'll kind of relay them back to her during the Q&A session, or yeah, the Q&A at the end. Aside from that, guys, the quiz at the end, Ollie, you want to talk about it?
Yep, it's the same format, multiple choice, 5 questions. As long as you get 4 out of 5 correct, you'll receive a certificate. And we're going to try the add-on one more time and see how that works. It seemed pretty smooth last time. The only thing was it cutting off. We'll see how it goes.
All right, yeah, but I think that's everything, guys. Thank you so much again for joining us. Leanna, if you're ready, it's all you.
Perfect. Okay, let's get started. Thank you for the introduction. So my name is Leanna. I am an OB-GYN PAC. I went to University of Detroit Mercy, and we'll kind of get into my background as well as, you know, what I did in undergrad and how my grad school experience went and what to expect if you are considering to be an OB-GYN PA. So to begin, So just a quick timeline, just so you all know a little bit about me. I'm currently 25. I was born in Miami, but I was raised in Michigan. I'm the oldest child. Growing up in school, I was always into the English and arts. And I like to point this out because it's not your very traditional math, science kind of major, if you will. It was never my thing. I never liked math. I was okay with science, but I never envisioned myself in medicine. In high school, I actually wanted to be an ultrasound tech. And then I realized I kind of wanted to be more involved in patient care. And so I ended up shadowing an OB-GYN PA who had known my father because my father is a gynecologist. And, you know, growing up around gynecology, never thought I was going to get into it. But I did realize that I wanted to be a PA, number one, because of, you know, how short grad school was in comparison to medicine, but also the ability to switch specialties at any point in your life without having to go back to school. And, you know, I'm very much a believer in that you having the ability to switch out of a specialty you may have not thought you weren't going to be interested in. Whereas, you know, if you go into med school and decide to be a doctor, you pick a specialty and you're stuck in that specialty for your whole life. So I quickly realized I wanted to be a PA, and at Detroit Mercy, they had offered a 5-year PA program. It was a direct admit, whereas a 3 years undergrad, 2 years master's, but you had to apply as a senior in high school. So I applied, got accepted, and then undergrad, I defined as the struggle. It was not fun, and I will go more into that. I started PA school August of 2017, finished in August of 19, got married in September of 19, my first job, November of 19. Okay, so I'm kind of looking on the side just to make sure I'm not really missing anything. Oh, it's hard to hear. Guys, is it hard to hear?
Oops. Yeah, we're not sure why, but we're getting a little bit of feedback. It's just kind of like a staticky noise.
What it could be. Still hard to hear.
So it's just hard to hear whenever you talk. So whenever you're not talking, it's pretty quiet. But then as soon as you start talking, there's like a staticky noise in the background.
Give me 1 second. Okay, you guys keep updated with the audio. I think it's like a computer fan sound.
Oh, wow. Well, whatever you just did fixed it.
Okay.
Yeah.
There you go.
So I'll just talk through the mic.
Definitely. And we want to make sure that we know that that guy in the background, we actually sent them from Pre-PAPals to help with tech support. That was us.
Oh, yes, for sure.
Yeah.
Yes. He's just...
No problem. No problem. You're very welcome for that.
Okay, I guess... Can you talk for a second, actually? Let me see if I can hear you through it.
Yeah. Testing.
Okay. Yes, I can hear you fine. Okay, good.
Perfect.
Back on track. Thanks for letting me know, guys. That's so annoying. Sorry. Thank you. Is this better? Okay, I'm going to assume it's all good and I'll keep going.
Yeah, 100%.
Yeah, sounds really good.
Okay, very good. All right, I'll keep going. So my background is a more non-traditional path. Like I said, I was a 5-year PA at the University of Detroit Mercy. I had applied with an ACT for those interested in the 5-year. I applied with an ACT of 28. That took 4 tries, by the way. I'm just going to be completely transparent. As far as classes I took in high school, the only APs I took were psychology and photography. So again, never took any math, never took any hardcore sciences. My GPA was about a 3.9. I did student ambassadors and was in the honor society. Okay, now the juicy stuff. So in undergrad, we were just assigned basically majors. So it would be a biology degree in 3 years. My GPA was a 3.7 cumulative by the end of the 3 years. My GRE was a 305 without the writing portion included. And my patient care experience was 1,000 hours. And that's the minimum that we had to reach to continue to save our spot in the program. For those wondering, I did become certified as a CNA, but I ended up working at an OB-GYN clinic, just kind of taking vitals, taking patients back and assisting and stuff. So I highlighted the 3.7 cumulative GPA for a very big reason, and that's because I want to talk about GPA deception. Okay. So I'm sure when you all see the 3.7 GPA, you're like, oh, okay, so she just got all A's and B's. No, my first semester of undergrad, it was pretty bad, guys. My bio lab, I got a C. Chemistry, I got a D. Pre-calc, I got a C. And I'm throwing these grades at you guys because I feel like there just isn't a lot of transparency. You know, I feel like there's like this rep or this idea that you need to get all A's and B's to get into PA school. That's just not true. So these are the grades I had approaching the end of give me 1 second, the end of the semester. But after communicating with professors and showing that I was trying quite a bit, pre-calc, he had given me a B- just because he felt super bad that I would go to every extracurricular and still not understand pre-calculus. Biolab, I got a C. It is what it is regarding that professor. And chemistry, she gave me a C only because she knew I was going to retake the course. So that is something to keep in mind there. Now, I was placed on academic probation that first semester because in the 5-year PA, you have to get a 3.5 or higher to stay in the program. And so I did not get above a 3.5. So they immediately put me on probation and I actually had a 2.8 my first semester. So that just kind of gives you an idea of, you know, just because you hear that someone's, you know, NGPA was a 3.7, that doesn't mean that they didn't have any rough patches, because my first semester was absolutely terrible. So we're going to talk a little bit about turning your grades around. My recommendation, the things that I did to sort of overcome this, is I retook classes I didn't do well in, because at my particular university, they had a swap out system. So if I was to get like a C the first time, it would, and then an A the second time, it would replace the C, which is great. It's kind of my saving grace there. So I got an A in chemistry the second time I took it, and that swapped out the C. And then what I did is I added on classes the following semester. So I ended up taking 7 classes my second semester, because it was the only way I would hit that 3.5. And then I took summer courses. So I realized that the PA program criteria was sort of a lot for me. So I split it. So if we had like a winter semester that had like 6 courses, I would do like 3 and then split the other 3 in the summer if I could. And that is what will increase your GPA at a much faster rate. So I always call low GPAs a blessing in disguise, because I sort of used it to my advantage during the PA interview. You know, it's a great way to show the program and committee how hard you work when faced with really low points. You show them basically times of struggle, but how you persevere at the end. And just one of my things is, I personally think the most beautiful quality any person can have is showing the hard work and dedication, and not just getting A's easily and then, you know, no effort, no hard work, no anything. So this is something that will really make you stand out. So for the PA students who always ask me about, you know, my GPA is so low, what can I do? All you have to do is show improvement, because that's what they're looking for. And as someone who didn't have a very strong math or science background, they actually appreciate that. Diversity is a very big thing in PA programs in general, as well as prioritizing patient care experience. So it really is about the overall picture. It's not so much about grades. It's not about what, you know, you scored on that GRE. They kind of look at you as a whole. Diversity is beautiful. What do I mean by that? I basically mean that, you know, it's not a cookie cutter program. It's not, they're not looking for the 4.0 students who do really well in the sciences and then they get over 3,000 patient care hours. It's more of they take people from different backgrounds that come with different stories, but relate their stories to wanting to become a PA. Doesn't CASPA not accept grade replacements? Well, I don't know if that's something that has changed, but the thing is with the university itself, it's swapped. So I don't think there would have been evidence, if that makes sense, that there were 2 initial courses. Yes, a number does not define you. That is the takeaway from this. It does not define you at all. Okay, let's move on. Graduate school, what does that look like? So year 1 is didactic year. It is basically books all the time. Every month you're learning a different specialty area of medicine. So month 1 may be cardio, month 2 may be pulm. You're doing anatomy, physiology, pharmacology. The way I survived it was I basically used a planner and I studied ahead. You never want to fall behind because you will get overwhelmed. The experience is stressful, but it's definitely not impossible. And to be honest, if you were to ask me the hardest part, you know, if I found undergrad or PA school harder, I would have told you undergrad, only because I just didn't know how to study and I didn't really know what hard work meant at the time. Okay, year 2 is clinical year. So this is basically every month you're rotating in a different specialty. When I started my clinical year, I actually thought I wanted peds oncology. And my first rotation was actually pediatrics. And that's when I realized I did not want to work with children. And this is kind of the year where you're focusing on each end of rotation exam that you take after every rotation. And then, you know, towards the end, you start preparing for the PANCE exam. You know, the big thing is make connections, because a lot of PA students got job offers from sites that they've rotated at. So it's very important that you leave a very good impression. My major was biology. Let's see. Okay. All right. So why OB-GYN? A big thing I kind of noticed going through all my rotations was I love taking care of women, you know, adolescent plus, meaning I would see 12-year-old girls and above. I quickly found out, and you're also going to find this out in rotations, that you're either going to be someone who likes to know a lot about something so specialized, you know, so you know a particular specialty very well, or you may be someone who likes to know a little bit about so much, you know, and that kind of divides family medicine, you know, internal medicine from something specialized like OB-GYN. So one beautiful thing about OB-GYN is you can either work strictly OB, strictly GYN, or a combination of both of them. You can either be working inpatient, meaning in a hospital setting, or outpatient, meaning in like a private practice or an office. There's a huge educational component. So if you're someone who has really saw yourself in kind of the teaching educational world and kind of wanted that balance with, you know, the medicine, it's a very rewarding specialty to be in. Of course, you're a woman's advocate, and I put in parentheses, especially for minorities. I'm a Palestinian American. I was not taught anything gynecological or OB, or never understood my body or how anything worked. And so I was really driven to this specialty because I wanted to be that voice for all of the Arab Americans and just all of the minorities who weren't educated when they were growing up on bodies. And then for those who are interested, there's a pretty large surgical and procedural component to OB-GYN if that's what you're into. And then of course, it's the work-life balance. Let's see. How do you get through? How does your job differ from an MD OB-GYN? So I just don't deliver babies. That's really the only difference, as well as doing like in the hospital surgeries. But there are some PAs that do deliver babies. It's just not something I do. No, do you do it? Or would that? So I work in a private practice, and like I said, I don't deliver babies. It would just be the supervising physician that did that. So that leads me to why I created the page. My Instagram page is basically a platform to discuss women's health. So every Monday we cover different medical posts pertaining to OB-GYN. Wednesdays are Q&As. This is kind of patient focused as well as pre-PA focused. And it lets pre-PA see what the everyday woman does not understand and has questions towards. And then Saturdays, I always go over patient case stories. And full disclosure, all of these opinions are my own and do not represent any institution or employer. So these are some of the things that I take care of as an OB-GYN PA. Okay, guys. So on a typical week, I'll do annual exams, PAPs, chief complaints of painful periods, irregular periods, pelvic pain, ovarian cysts, STDs, birth control. Prenatal care, meaning, once a woman is pregnant, the care that she receives during her pregnancy, PCOS, endometriosis, vaginitis, etc. To the right, you guys are going to see the different procedures OB-GYN PAs can do depending on the state and how many things PAs are able to do in that particular region. So DNCs, ablations, colposcopies, IUD inserts, endobiopsies, vulvar biopsies, Nexplanon insert and removal. Those are all done in office, though. You don't have to be in a hospital for that. Is there a drastic difference in pay between OB-GYN MDs versus PACs? Yes, there is. And that's, it really just the salary difference. That's why, with the MDs and the DOs, it should be expected that the pay is obviously a lot more. I don't know what the average is. I want to say like 200,000 for like a OB-GYN doctor. Don't quote me, I really don't know. And then for, OB-GYN PAs, as well as nurse practitioners, it could be anywhere from 85,000 to maybe like 105. But that's very dependent on where you work. So that's not like the full picture by any means. Do you ever feel that OB-GYN is dominated by midwives or nurse practitioners? Yes, I do. It's very NP dominant to the point where, a lot of PA programs are struggling to even find OB-GYN sites, OB-GYN rotations for their students. And, that's kind of one of the big struggles when you look to applying to OB-GYN jobs is people tend to pick nurse practitioners over us. But, you just have to fight for them. How is the best way to deal with a mother who does not want to leave the room when her daughter is being seen? So we have a policy in the office where we always say that we want to bring the daughter back first. We don't typically let the mother in. And right now we can kind of use COVID as an excuse. So typically moms don't have an issue just so long as we're telling them we're going to bring them back in like a few minutes, So OB-GYN PA outpatient schedule. This is what my typical day looks like. These are my hours of work. Friday's cut off, but I don't work Friday. So it's basically office hours, and that's just what I wanted for me in my career. Some people like the 12-hour shifts, 3 days a week. But this one was just my preference and fit my lifestyle best. And as you could see, on this schedule, you see anywhere from, on this particular day, 19-year-old to 66-year-old, and they're coming in for what? STD testing, reviewing labs and ultrasounds, UTIs, and then prenatal visits. I definitely prefer an outpatient setting. I do not like working in a hospital. It's just peaceful outpatient. It's quiet, what your hours are, there are no surprises, the patients you're going to see. It's not hectic. I'm a very planned out person, very punctual. How many patients do I see on an average day? So it can really vary anywhere from, 10 to 20. The maximum, I'd say most OB-GYNs see in general maybe 20, maybe 25. It really depends on the clinic. So let's go over our first case study. So we have a 20-year-old G0, her LMP. LMP means last menstrual period. So you guys are going to find that the lingo for OB-GYN is very weird and confusing. I would say one of my biggest hard stops when I first started working in the specialties, I didn't even understand what the notes were saying. I did not know any of these abbreviations. So if you were to say what was one of the hardest things, I would say it's just understanding the lingo in OB-GYN. But anyway, LMP was 11-13-20. Chief complaint, heavy irregular periods. So she's 20 years old. G0 means that she's never been pregnant before. Her LMP last menstrual period, which is the date that she got her last period, was November 13 of 20. And she's coming in for heavy irregular periods. She says that since she started her period or menses at the age of 11, they have always been irregular, stating she has gone anywhere from 2 to 5 month intervals of not getting a period. She also admits to an increase in facial acne over the past year and states that despite dieting, weight loss has been difficult. This patient has never been to a GYN before. Anyone have, I see that some people kind of already know what it could be. Yes, G0 means that she's never been pregnant before. Anyone have any ideas or thoughts on what could be going on with this 20-year-old patient, or what we would maybe want to know further? I'll give it like a minute before I go on. Smart. Christina, Julie, Provi, I hope I said that correctly. Hannah, okay, yes, everyone is correct. That would be my top differential is the PCOS. So let's go over that. So I take you guys step by step as if you're in the room with me. This is what I do. Now, some people in the specialty may find this excessive. Like, why do you need to know all of this information? But I just feel more comfortable knowing their thorough history. I'll ask about medical conditions, meds, surgical history, family history. And when I say family history, I mean history of breast, ovarian, uterine, colon, or cervical cancer. That's what I mostly care about. This patient, none of the above, no pertinent history. She doesn't smoke and she doesn't drink. Sexual history, she denies, and she says that she's never been sexually active. Now, if we all look at her vitals, everything's fine. Her blood pressure's fine. Now, she's 5'3" and weighs 226 pounds. Okay, so she kind of has a higher BMI, and she's someone who's been struggling to lose weight. Okay, so physical exam. Now, on the left, you're going to see what a comprehensive GYN exam consists of. It's a general appearance, you know, how they look from you looking at them. A breast exam, abdominal exam, and a pelvic exam. Now, that pelvic exam, you're looking at their vulva, vagina, urethra, cervix. On the manual, when you stick your fingers inside, you're looking for the uterus and the ovaries. And then for rectal, and by rectal, I mean like you're visually looking around the rectum to see if there's any hemorrhoids. Now, remember, this patient has never been sexually active. So with her, she actually refused the pelvic exam. And this is just something that a lot of virginal women will decline because of the, you know, the speculum going inside. Now, some virginal women will agree to get examined, but I would say majority of the ones that I run into, especially the younger girls, will decline it. So as far as appearance and abdominal exam, now when I'm pressing on her belly, I'm just making sure I don't feel for any, you know, abnormally large masses or anything or any abnormal tenderness that she's having. And there was nothing. It was normal. Oh, I'm so sorry. I'm not explaining the abbreviation. PSH is past surgical history. Okay. So for irregular periods, it can be a normal variant in young women due to hormonal imbalances, but you want to rule out specific conditions, especially with her complaints of weight gain and increase in acne. So the labs that you want to order are FSH and LH. These are, you know, hormones that kind of make up a woman's menstrual cycle, okay, in the most simple, basic terms. Testosterone. DHEAs, fasting insulin, TSH, which is your thyroid, prolactin, and a beta HCG. Why do we want to do a beta? Yes, Diana, you want to check those glucose levels. So for her, we're doing her insulin. TSH is for thyroid. You want to assess their thyroid because those with thyroid conditions like hypothyroid or hyperthyroid can actually have irregular menses. Okay, I am going to continue here. So we want to, a rule in OB-GYN is you always rule out that she's not pregnant. Even if you don't think she's pregnant, even if she's telling you that she's not sexually active, you need to rule out that she's pregnant first and foremost. So, you know, a preg test is always done when she comes in, and then a beta level is drawn because a beta can catch the blood levels a lot earlier. So conditions to test: pregnancy, PCOS, thyroid, and prolactin. The bolded are the abnormals. So as far as FSH and LH go, in girls with PCO, the LH will typically be double that of the FSH. So in this case, it's more than double. Her free testosterone was elevated, and her fasting insulin was borderline elevated. Her prolactin and thyroid were fine, and her beta indicates that she is not pregnant. So with that being said, yes, I'm getting a lag in the comments, but yes, you're all right with the beta. PCOS. So based off of her labs, you have a pretty high suspicion that she does have PCOS. And this is one of the, you know, most common misdiagnoses as far as conditions go. So just kind of keep that in mind. And so many women are delayed in their treatment regarding PCOS. So if you feel like you're someone who could potentially have this going on, you may want to see your GYN for all of you ladies out there. Okay, so what is PCOS? It's the most important cause of menstrual irregularities in androgen excess. The menstrual irregularity, that basically means that the woman will either have less than 9 periods in a year or over 3 months with no period. Androgen excess means that they'll have an increase in body hair loss, or acne complaints. Different providers use different criteria to officially diagnose someone with PCOS. I personally use the Rotterdam criteria per UpToDate. And the woman has to meet 2 of the 3. Oligoanovulation, meaning she either doesn't have a lot of periods or no periods at all. Hyperandrogenism. Now, this could be counted if it's only based off symptoms or only based off lab work. In her case, she had elevated testosterone, her LH and her FSH. The LH was doubled, and she had a little bit of insulin resistance, which is a big thing in PCOS girls, hence why they have a harder time losing weight. And or you could have polycystic ovaries. Now, the best way to see polycystic ovaries, you'll see here, it's all these little cysts right over here. They typically call it like the string of pearls if you're in PA school. But the thing with this, especially in young girls who are virginal, the best way to see these is through transvaginal ultrasound, which a lot of girls will not tolerate. So in her situation, though, she already met 2 of the 3. So she was someone I could officially diagnose with PCOS. Now, as far as treatment, she had a few options. One of them, which a lot of PCO girls do really well on, is just step 1, which is lifestyle modifications. I've had girls get regular cycles once they lost weight and were, you know, kind of being mindful of what they were eating. And if that doesn't work, and for some people it just won't, you can get them started on combined birth control pills as long as they're not trying to conceive. And those birth control pills will help regulate her periods and balance out, you know, everything going on. And then metformin is kind of the add-on if the above 2 don't work, and especially necessary for the women with a lot of with very high insulin levels, because metformin will also help them in losing weight. A big thing, we want to make sure she can take the combined oral birth control pill. Does anyone know what can happen to someone, or what criteria we look for, who cannot take a combined oral pill? These comments are so laggy. Okay, so women who cannot go on combined oral contraceptive pills are women who are above 35 and smoke, women who have known heart disease or really, really high blood pressure because those pills will possibly elevate it. Yes. Okay, they're coming in now. Exactly, PEDVT. So we're concerned about potentially giving them a higher risk of blood clots. So we got to make sure she's not 35 and a smoker. If she's a smoker and under 35, she can still take them. You want to make sure she has no history of blood clots with herself or with immediate family members, because if she does, if her mom, has a blood disorder, we would test her for it. So that's something to be very mindful of before you give anybody a birth control pill. And then in her situation, what I did is I gave her the pill, gave her the lifestyle modifications lecture, and then I'm going to be seeing her in 3 months to make sure that she's happy with that birth control pill. Because there's a lot of bad stigma out there regarding birth control pills. But I think what a lot of women don't realize is there are so many different pills taken so many different ways and so many different dosages, as well as different components. So it really is just about finding their perfect match. Okay, I want to give a disclaimer. This next case study does have a picture in it. If you're not comfortable seeing lady parts, which I don't know why you would be here and not be comfortable seeing that, but this is just a disclaimer that there is a picture in this case study. Okay. All right. So patient number 2, we have a 75-year-old G2P2 LMP 1997 with a chief complaint of a bulge coming out of her vagina while showering. So she's a 75-year-old G2P2. So she's been pregnant twice, has 2 living children. She's a postmenopausal female. She's coming in today because she feels like a bulge was falling out of her vagina when she was showering. She states that it only happened once, but then she never felt it again. She states that it was completely painless, but she's just scared that she has cancer. Any thoughts on what is going on with this patient? Oh, you guys are so smart. Yes, Hannah, G2P2 is correct. And Marvin, Julie, Hannah, Julie, Michelle. Great. So notice how you all are thinking prolapse. Now the question then becomes, what kind of prolapse does this patient have, right? So again, we're obtaining our thorough history since I didn't do this last time. PMH is past medical history. Hers was fibromyalgia. Meds, she's taking nothing. PSH is past surgical history, none. Family history, her sister had cervical cancer, hence why she thinks that this is what it is. Social history is SH. By social history, I ask about smoking as well as drinking. She doesn't smoke, but she's a social drinker. Sexual history, she's a widow, not currently sexually active, and has denied ever having an STD in the past. Her vitals are pretty good for the most part. So the physical exam, again, to the left is what, we would do on like an annual. For this patient, we did abdominal, pelvic. We took a look at the vulva, the urethra, the vagina. And then I noticed as she was talking to me, she had, as she was talking and I'm examining her, I noticed every time she laughed, something was like popping out of the orifice. Okay. So as you all said, this is a type of prolapse, most likely. But we have to figure out what that prolapse is. Like, what are we even looking at down there? So what is the bulge? And I think this is the disclaimer for if you're not comfortable with pictures, maybe don't watch this part. Okay. Top differentials, like we said, is prolapse. So if you look over here at this square here, this is your normal anatomy. Okay. Now I'm going to try to kind of explain this in my little view square here. This is how I always, WNL means within normal limits. I'm sorry with these abbreviations. Okay. So I always describe the vagina like a room to my patients because this is actually the analogy my dad would give his patients. So the vagina is like a room. Okay. So when we put that speculum in you, we're looking inside of a big room. The ceiling of this room is where your bladder sits. Okay. The floor of your vagina is where your rectum sits. And in the back of your room is where your cervix is that is leading to your uterus, okay? So when the ceiling of the vagina is drooping, that's your bladder, it's bladder prolapse, okay? If the floor is bulging up, that's rectal prolapse. If the cervix goes from being back in the room to the front of the room, that's uterine prolapse. So this is not, of course, her. This is a Google image that I thought kind of looked similar to it in a weird way. So that's what I saw every time she laughed. It would like pop out. And so for those asking about what grade it is, it's kind of in between a 2 and a 3. So like a 2.5, because, you know, it's kind of at the bottom, but it's not to the point where it's just hanging out of her, if that makes sense. So I hope that analogy was helpful for the prolapses, because that's the best way I think people can understand it. So what happened is I stuck my fingers in, because that's the best way to figure out if it's, you know, shout out to David for being a guy here. Just want to say that. So I put my fingers in, and what I'm doing is I'm trying to figure out if I can feel in the back of the room where the cervix is, because that would mean that this bulge up forward is probably not it. So I stick my fingers back there. And when you become used to doing female exams, you know what a cervix feels like, as well as like, you know, just how it feels. So with her, I felt her cervix back there. And then I realized as my fingers are in, I'm like lifting basically this bulge. And I tried to pop it back up there, and it did stay for a little bit, but it was basically concluded that the ceiling was coming down, or that her bladder was prolapsing, which is not an uncommon thing with a woman in her 70s. It's just the weird thing is she wasn't having urinary symptoms. So she wasn't having urgency, frequency, nothing like that. It was literally just the bulge. So that's what we call a cystocele. Okay. So for her, I basically explained to her what was going on, and she was very happy. And at the end of the day, all she really cared about was that it wasn't cancer, because her sister had it. So understandably so, she was, you know, super nervous about it. And so, you know, treatment options can vary depending on the patient. Now, she is someone who wasn't having a lot of urinary symptoms, but I did offer her a pessary, which is like basically a little ring that gets popped up there and holds everything in place. Or she can do pelvic floor therapy or even surgery, but she opted for none of them. She said it's not bothering her as long as it's not cancer. She's totally happy and just wants to, you know, move on with that. So her follow-up would be routine. We would just want to make sure it's not getting worse over time or becoming like to the point where the bulge is hanging out consistently. So I just wanted to list other things, you know, basically it just shows the different ages with the different chief complaints, because OB-GYN, although it's so specialized, you know, you see so many different things, whether it's a 12-year-old for painful periods, 19-year-olds for birth control consults, STDs, discharge, pregnancy, pain, urinary incontinence, breast lumps, prolapse. There's just a lot. And then, of course, not to forget about the pregnant patients. That is not a dumb question. So Sabrina's asking, how does prolapse happen? My grandma had one and I don't remember. So prolapse, you know, like how I described that in the vagina, that ceiling is kind of getting held up by muscles, pelvic floor muscles. And so when that ceiling is dropping, when that bladder is dropping, it basically means it's just a weakening in the pelvic floor muscles. How does that happen? Having children, you know, being obese, diabetes, things that predispose you to just having weaker pelvic floor anatomy, essentially, which is why they always tell us just do Kegels. So would you refer this patient to a specialty like Urogyn? If it was to the point where she wanted to discuss like surgical management, absolutely. All right. So in conclusion, just things to remember from this PowerPoint is that the most beautiful qualities an individual can possess are persistence, dedication, and hard work. Don't let the low points define you. You can only move up from it, as we saw with my 2.8 GPA. There is no model student in PA school. We all come from very different backgrounds. We all have different strengths and weaknesses, but we all have the same common end goal. Find what you love and do it. The beauty about being a PA is the ability to switch specialties if you feel that you haven't selected the right field. This is a huge reason PAs are happy in their careers. And if you find a particular area in medicine that you are passionate about, reach out and apply. Just go for it. That's what I did. So I applied to OB-GYN spots when they weren't even asking for a PA. They were asking like for a midwife or a nurse practitioner. And I remember I got so desperate, I was even applying to jobs that asked for physicians. I was really pushing the limits there, but look into residencies to further your education and always make connections, because at the end of the day, it really is who you know. And then of course, if you have any private questions or specific questions, you can always message me or private message me on my Instagram page. So let's do this Q&A. How do you go about switching specialties? Great question. The beauty about choosing PA as your path is you don't have to go back to school. So if you're in pediatrics and you decide, I don't like kids, I want to do internal medicine, you just apply to an internal medicine spot. If you want more OB-GYN shadowing, I think it's like really complicated with COVID. So it really just depends on the OB-GYN offices near you. We've had like emails come into our office for people asking, so it wouldn't hurt to kind of look around the area, send emails to like the office managers at these clinics to ask if they're taking students. I did not do an OB-GYN residency. I wish I did, but there aren't. I think there were two, one in New York and one in LA, but I believe the one in New York is no longer a thing. Am I accepting shadows in person? I've thought about this for a while. I'm kind of still in that gray area where I actually talked to my supervising physician recently, and we both agreed that as long as the student coming in had both COVID vaccines as well as a recent negative COVID test, that we would consider taking students within the next couple of weeks, or just shadows. What other specialty would I do if it wasn't OB-GYN? I feel like internal medicine, which I know completely contradicts like what I said about knowing something so specific over something so big, but I really love like the older population. And I would definitely would have worked in an outpatient setting. I work with 2 nurse practitioners, and I do not find any change in treatment. If anything, I really admire my nurse practitioners. They both have like 30 plus years of work experience. So they really are my teachers. They're kind of my go-to ladies. I love working with NPs. The supervision is exactly the same, and we always help each other out. Oh my God. Guys, I am so sorry. There's so many questions. I'm going to try to get to them. What was your favorite and least favorite clinical rotation? My favorite was probably either OB-GYN or psychiatry. I really love psych. My least favorite, probably general surgery. Yeah, general surgery. It was, no. Do you see patients on your own, or do you have so I see my own patients, but in the office, there is a supervising physician that I will go to if I need any questions answered or any assistance, but I see my own patients. I don't, yeah. How often do you see men? Well, my father is an OB-GYN, and unfortunately, it's so much harder for guys. And this was one of the
the things I felt so bad for was even there are some clinical sites that will say, we'll take students, but they have to be females. So it's definitely harder for males only because there are so many patients that just are not comfortable with the male. But it's not impossible, but it definitely is going to be more of a challenge for you. What is the coolest favorite case you have ever seen? Now, I'm not going to say it's the coolest because most of women's health conditions are something that I wouldn't really wish upon anybody. But I would say one of the most interesting ones I've seen was when a patient had actually come in with like a new outbreak down there. And so you would immediately think herpes simplex type 2, but she was actually someone that had type 1. And I've actually seen a couple of them now. So be careful with those HSV type 1 cold sores because they can cause genital herpes, guys. Just a disclaimer. Can you put your IG info? It's in the beginning part. I'm not tech savvy in case any of you noticed, but okay. This is my IG info, leanna.a.the.pa. Do you prescribe medicine? Yes, I prescribe medicine. What was hard about general surgery? I just feel like it wasn't my personality. I'm very much someone that loves to communicate and get to know my patients. And the thing with general surgery is you don't really talk to them. You're just kind of like in the operating room, there under anesthesia. Like, it's too much stress for me. It just didn't fit me. What is the PA-NP to physician ratio at my office? So good question. We have one physician, 2 nurse practitioners, and I'm the PA there. I've thought about general. Props to everyone thinking general surgery. You know, general surgery is actually, I would say, one of the job specialties out there that they're constantly looking for PAs. I felt like when I was applying to jobs, that's all they were asking for. Do you work with transgender and gender non-conforming patients? I do. I absolutely do. The thing about working in women's health, guys, is you cannot be judgmental. You cannot be, you have to be very open and accepting of all patients that come and see you because this is a very, very sensitive specialty. And if you're going to be judgmental, this is not a thing for you. You're going to be dealing with women who do abortions, dealing with STDs, dealing with just the craziest stories patients will tell you. And you have to be respectful and mindful of that. Yes, the NPs do exactly what I do. How do you, oh my God, I feel like I'm not going in a line here. Do I have a scribe? No, I type everything out. And I feel like that just makes me more comfortable. Is there a difference in the way HSV1 and HSV2 looks like in the genital region? Typically, no, because HSV1 and HSV2 are viruses that cause genital herpes. So both of them can result in the same thing being genital herpes, which basically looks like very painful blisters down there. How do I deal with breaking hard, unexpected news to patients? You just have to be very sympathetic, empathetic. Women's health is just one of those things where you have to be really passionate about it, or you aren't going to necessarily be the best provider you can for your patients, because I just have a natural love and tendency to educate women. And so when I have to call her and tell her that she has X many STDs, it's one of those things that you just have to approach in a very like calm way, but also be ready to sit on the phone for like 20 minutes with them if they need to vent. So based on my experience as a student, what do I consider is most important to learn during the OB-GYN rotation? Well, I would say understanding G's, P's, LMPs. I will tell you guys a funny story. It's so embarrassing, but I will tell you anyway. So my first week working in OB-GYN as a PA, it was my first week, and I was basically working alongside the supervising physician who had hired me. And she had asked me to call labor and delivery and basically say, to sign someone to schedule an induction for this patient. So I get on the phone and I'm super nervous because I'm just an anxious person when I talk on the phone. I don't know why. And she's basically like, okay, well, what's her EDC, the patient's EDC? And so the first thing that came to my mind was her estimated date of conception. Like, I thought she was asking me when they conceived this child, like when they had sex. And I'm just like, I was not prepared. I was like, what? And I remember I was like, I'm gonna have to get back with you on that. And I like hung up the phone, and then I went to the medical assistant and I'm like, she just asked me when they conceived. Like, am I supposed to know that information? And then my physician, the supervising physician, came to me and she's like, so did you schedule induction? And I'm like, she asked me for the EDC, like, where do I find this out? And she's like, EDC is EDD. So please learn from me. EDD is the due date. Okay. EDC is an EDD. So please don't be like me. That was so embarrassing. Okay. So is there no major difference between NPs in your role? There is not. The biggest difference is just your background and the way you sort of, maybe sometimes there'll be treatment differences, because keep in mind, nurse practitioners were previously nurses and they've learned their education based off of the nursing model, whereas PAs approach treatment of patients in more of a medical model setting. Kind of personal. I love personal. What do you normally do outside of work that makes you feel good and happy? Wow, I am probably one of the most boring people you will ever meet. But what makes me feel good and happy is keeping in touch with all of the women and men on this page. You know, this page kind of distracts me from a lot of things, but it keeps me up to date on so much information that helps me with work. So it probably sounds super nerdy of me, but I've never been big on social media. I'd never even had an Instagram prior to this. So being able to answer questions and be there for all of you guys on that page, and every week talking about a different topic and talking about my life and what I experienced at work, that's kind of what I do outside of work. I know that sounds so weird. So yes, EDD is EDC. They're not asking you when they had sex. What do I do outside of work? Please talk about balancing life stuff outside of work and when you were in school. Guys, you can balance a work-life situation like in PA school. Like, I never felt like my whole life was school. It was never like that. And you're not going to really stay sane if it's like that. Yes, EDC is estimated date of confinement. It's not conception. Thank you, Marvin, for Googling it. It's something I should have done. And one thing to please take out of this is when you finish PA school, you are not going to feel ready to be out in the real world. I was not ready. I mean, I just told you guys that ridiculous story. Like, you're just going to feel dumb sometimes, and that's just part of growing. How do you declare a specialty as a PA? You basically graduate PA school and then apply. So one thing that kind of irked me, to be honest, guys, is when I was in PA school, everyone was like, there are so many PA opportunities out there. Like, you're going to get a job during rotations. Like, PAs, the spots are endless. No, it took me, and I was one of the people who got jobs faster. It took me 3 months to find a job. I was applying to so many specialties I didn't even know existed because I was just desperate. You know, I was applying to urgent cares, and all that. So it's, I mean, I've had one of my closest friends in PA school is now in Connecticut because he couldn't find a job here. So that was one of the things that sort of annoyed me. I don't work with babies, no. You know, Melody, she says, do you think that there is a better name for women's health to be more inclusive for transgender and non-binary folks? Absolutely. As far as, you know, I think over time, things will kind of start changing. And I think that more and more, you know, the new generation of OB-GYNs coming in would have been adapted to and informed of and accepting of, you know, like the LGBTQ community. So it's something that I think needs to kind of, I think it's something that will definitely change over time as far as like verbiage is concerned. But one thing to keep in mind is, unfortunately, as of right now, there are like, you know, we had a patient call us saying like, I'm transgender, will you see me? Because there are some offices that like won't even, they just won't even take them. It's just crazy. Where does my friend work in Connecticut? I have absolutely no idea, but he's a neurosurge PA. Shout out to Thomas. And what was funny is he would have never thought he'd be in neurology, let alone doing burr holes in people. So you really never know where your life is going to take you when you're in PA school. What did I dislike about peds? You know, there is nothing I necessarily disliked, but I just found myself, I love to be able to communicate and really get to know my patients. And then with children, you know, they either cannot talk or you're usually talking to the parents, and then it becomes, you know, more so a conversation with parents than the actual patient. And it just wasn't my thing. I'm in Michigan. I live in Novi, but I grew up in Downriver. So shout out to anybody who even knows what that is. How do you go about finding PA jobs? I used Indeed, ZipRecruiter. I really like ZipRecruiter. Oh my God. I really like ZipRecruiter because it like tells me when they like viewed my resume. The parents are terrible. Oh, yes, David. They kind of are. What do you think? It was so difficult. I think it's difficult for people to find jobs after PA school because in Michigan specifically, there are like 8 PA programs, most within the Metro Detroit area. So we're all fighting for clinical sites. We're all fighting for jobs. There's just too many of us in this region, too much. And for those in PA school, I don't know if we have any in PA school, but I do have a highlight here on my page here, PANS Prep. And for those of you who eventually get into PA school, I literally went step by step explaining how I studied for the PANS, and I even made you guys a calendar because why not? Yes, rep in Novi. Okay, I'm surprised by Novi. Yes, I too. Oh my God. I too was surprised to find out that PAs had a hard time finding jobs because that's not what they told me. Yay, Grozeal. Cool. I was in Riverview. I grew up in Riverview. Hello, Wayne State. Indeed will be my best. Indeed will be your best friend indeed. LinkedIn. Yes, I have to be honest, I wasn't a big LinkedIn user, but that is how a lot of people make professional connections. How would I professionally handle a teen pregnancy with a rude parent that wants in the room? Now, I don't know the specific rules, but to my knowledge, if she's a teenager and pregnant, there's like a disconnect, like the parent can't be involved if the patient doesn't want them to be. How long did it take for me to feel like I actually knew what I was doing? Here's the thing. So when you start a new job in a new specialty, things are crazy for, I'd say, the first couple months, but then certain things start to become repetitive. So the first things that were repetitive for me, annuals, pap smears, vaginitis. So what had happened is once I was comfortable with those three things, the doctor would put my schedule on all those things. So that's all I was doing over and over again. And so when I was ready, I would like add on something else. Hello, Livonia. Did you do a fellowship? I didn't do a fellowship or a residency. Any advice on overcoming squeamishness? Well, with the masks, it's really helpful to kind of hide your emotion. Okay. I didn't attend conferences. I'm going to be honest. I wasn't like super involved. I just wanted to graduate. How would you handle a patient who had an STD like HIV? But guys, let me tell you a story. It was actually on my patient case story, I think a week or two ago. I had a patient who was positive for like 3 STDs simultaneously. And I had told her like what I always do, which is tell the partner. And she just straight up said no. So I remind her that, okay, well, think of the other women that could potentially get all of these diseases. So guys, please, and girls, use condoms. You don't know people. I feel like I'm talking to you guys like you're my patients. Trust nobody. Like when you're in this specialty, your eyes are open to things you never thought existed. Do patients feel apprehensive or address you as doctor when you introduce yourself as a PA? A lot of my Google reviews, they call me Dr. Leanna. And that's just the way it is. You just, you present yourself as a PA, and whether or not, sometimes it's the same thing to them. And they do it with the nurse practitioners too. A lot of times when you become their primary, they just call you doctor and kind of roll with it. But I've also had opposite experiences. So for all of the younger individuals who are in PA school are going to be a PA, I've had patients laugh when I walk in because they're just like laughing out of nervousness. Like, you're like 12 years old. Why are you touching me? How was my experience with CASPA? Gloria, I'm going to be honest with you. So the thing that I'm not good at, and if I don't answer these questions, it's just because I don't feel like I can really say it, like really explain my experience. It's because of the fact that I was in the 5-year. So things like CASPA, I kind of just did nonchalantly, knowing I already had a spot in PA school, but I did have to go through the steps of the application and the interview. It's just that like I wasn't as focused knowing I had a spot. So I just feel like I'm not the best person to ask as far as guidance, because again, it was done to get done, not to try to actually apply, if that makes sense. For PCE, is MA or CNA a better route? They're both great. One isn't better than the other. If you were to ask me personally, I would say I think it would be better for you guys to become a medical assistant, only because when it comes to clinicals, like doing injections, doing things like that, the individuals who had MA experience were super good at it and like unfazed, where like all of us CNAs are like, oh my God, I like don't even know how to give someone a shot. Sorry, Gloria, I know that wasn't helpful. I just introduced myself as Leanna. I like to keep a very like friendly relationship with my patients. So I never say like PA this, or I literally just say Leanna. Yeah, I like the name physician associates. I don't know if they'll ever like change it. I feel like now the PA profession is growing so much that people understand that a physician assistant is like a PA, like they understand the role, versus before where when you would say physician assistant, they'd be like, I don't want to see the medical assistant. Like, how is that a thing? How hard is it to get documentation done? I try to do it after each patient. Sometimes I pre-chart. So if I see someone coming in with vaginitis, I'll like completely put in the whole note, put in the PE I would have done, so that the only thing I have to do is put in the plan and then like bold the findings. So you just have to schedule a note to where it's like the most efficient. This wasn't, so please talk more about that one at your new, okay. Yes, I did a 5-year PA program. So my first job was also an OB-GYN position. But when COVID started, I basically was looking for a new job. So I'm in a second OB-GYN position, which I absolutely love. And I've gained knowledge in both positions. I'm a very short and petite woman who looks very young. How do you obtain trust in those who are older or more traditional? Rather see the MD. So, I mean, when I walk in, I would say most of the time, no one says anything. And I think it's because of the masks too. It like covers half my face. But I've had like older women, especially older Arab women, look at me and be like, you know, the thing about me is I understand some Arabic, but I'm not fluent in it. So I speak in English. And I had this one older woman and I walked in and she said in Arabic, she was, because she didn't know I understood. And she was just like, oh my God, look at her face. She's literally a child. Like, this is the doctor. And like her daughter was there to translate. And so most of the time they may make comments, but at the end of the day, as long as you come off as very professional and knowledgeable, they don't really care about the age. Julie, what did Julie ask? Oh, that's the one I just answered. Okay, I hope that answered that question. Gloria, I think having a sonography background is absolutely fantastic. I honestly wish I did, being in this specialty. I'm here for honesty, guys. You can ask whatever you want. That's kind of why I'm here. I'm very transparent. How many hours? What's your opinion on working in a medical field like PA and having my significant other being in a non-medical field? Like very, very different jobs and career. I mean, I think it keeps things interesting. I mean, he doesn't like to hear my stories because it's just, when I had to do telemedicine when COVID first started, you know, me and my husband were both working from home. And I was, you know, doing telemedicine. So all he was hearing for weeks was, and is your discharge itchy? And you think you have an STD? And what smell is your urine? So it keeps the relationship very interesting, to say the least. Yes, we all have these baby faces, you know. It's a struggle, but it's fine. I don't see why a PA can't get their doctorate, but I don't find that a lot of them do. I can definitely imagine, yes, Middle Eastern grandmothers are the best. They really are. Oh my goodness. What are my future career plans? You know, I just want to be the best OB-GYN I can be to my patients. And I kind of want to grow with them. One of the beautiful things about OB-GYN is you grow with your patients. So all the girls I'm seeing that are in their 20s with me, I'll be hopefully seeing when I'm in my 60s and they're in their 60s. So I don't know why. I don't know. I don't know of a lot of PAs that work in another country. I think Canada may have. I know there are certain like areas in Canada where they have working PAs. Hardest part of being a PA, I would say, is just the fact that you have 1 year of book work, 1 year rotation, and then you're out in the real world. So one thing you all really need to prioritize is when you do start job searching, you find a physician that is willing to teach you, because that really is going to build your foundation on what kind of provider you're going to be. I do struggle to answer all the patient's questions. I do. And you kind of have to learn like a way to basically get them to stop talking, like in a professional way, because a lot of times with OB-GYN, they tell you about really random stuff that isn't relevant to like the particular visit. So you just kind of have to work around that sometimes. No. Wait, do I have a lot of work to do outside of when you are physically? No. When I leave work, I'm done. I'm done with charts. I'm done with notes. I'm done with telephone encounters, with sending meds. I didn't work when I was in PA school. One thing to keep in mind, guys, is there's also 3-year PA programs. So for individuals who like have a lot of kids or plan on working while they're in PA school, there are also 3-year programs. Like they have a 3-year program at Mercy, which is also pretty awesome for individuals that need to balance school, but also like life. That is true, Julie. A lot of patients want you to solve their life problems. Oh, man. Do I find that you are earning about as much as you expected to earn as a PA? The salary talk regarding PAs, it varies. It varies based off of the setting you're in, the specialty you're in, what your work schedule is, what your hours look like, what benefits are they giving you. So to be honest, guys, going in, when I graduated PA school, I felt like I knew nothing. And so I was not someone who was looking for a big salary. Like I felt like, how can I ask for something like that when I'm going to need so much education and so much guidance? You know, down the line, when I have years of experience, that's a different story. But as a new grad, I didn't want to be selfish. But some people may have a different perspective on that. They may say, well, this is what the average is, and this is what we deserve. It's just, you have to find what suits you and what you're interested in. Guys, the GRE, as far as studying, study the math. As far as the English, my personal opinion, it's just luck. My friend Thomas, who I talked about earlier, when he finished his GRE English portion, he said that knowing Pokemon helped a lot just because of like the Latin components of English is just, I don't know. So to be honest, I didn't study for the GRE because one of the requirements for us is we just had to get above a 298. And I think the average in the US is a 305. What determines who a patient sees at your clinic? Are the patients just all divided up, or is it based on severity? So we'll ask the patients when they call in. They may recommend a certain provider. They may ask for a specific person. But if they're coming in for pre-ops or anything surgical or like delivery related, they will meet obviously with the supervising physician who would be the one performing the surgeries. Does the US have a 2-year PA program, and also do you study at the medical schools? No, there are PA schools. At Detroit Mercy, they didn't even have a medical school, but there are specific PA schools that you'll be studying in. And yes, so typically in grad school, it'll either be a 2-year PA master's or a 3-year part-time master's. I think, Gloria, if you're able to work and go to PA school, I mean, I think that's totally reasonable. I think just so you don't get overwhelmed, it may be a good idea to look at maybe like even a 3-year program. Honestly, I don't know much about online PA programs, but I imagine that's going to become more of a thing because of COVID. Our 5-year direct programs look down on you. The thing is, they're not looked down on us because the years that were cut were undergrad. So we still had just as much master, like a 2-year master's. The only thing that we didn't have was the additional year of undergrad. And I mean, undergraduate coursework, we all know, is not the most pertinent to what you actually end up doing for a living. So no one looks at it that way. If anything, people just may be a little standoffish in that you're going to be a lot younger than most of the PAs that are graduating. I'm actually working in the office, Michelle. So I'm not actually doing telehealth anymore. And I got to be honest, I'm so happy about that because I did not like doing telehealth. But should be open. So I will definitely let people know, especially who are in the area, when I am going to start letting shadows come in with me. To be honest, just for my comfort, it'll probably be only like a 1 or 2 day shadow opportunity, but I guess a little is better than nothing for you guys. One thing I also really want to stress, when you guys are looking for PA schools, please inquire about number one, if you're interested in the specialty, make sure that they actually have a lot of available sites because some PA programs aren't able to get them. And number two, you may want to ask about where these sites are located during your clinicals, because there are some PA programs that have you moving like out of state for some clinical spots. So if that's something that's not, reasonable or something that you're able to do, that's definitely something you want to ask when you're interviewing at particular PA schools. All right, guys. Yes, that is true, Patricia. So Patricia asked if we have significantly less required healthcare hours for the 5 years, and we do. Oops. And we do. We needed a minimum of 1,000. I didn't necessarily feel less prepared than all of the other individuals we were in the master's program with. But I did feel like I wish I would have, like I said earlier, been like a medical assistant or someone who is more hands-on clinically, or like a phlebotomist. So yeah. Yes, I did the 5-year direct program. Exactly. So 3 years undergrad, and then as long as you meet the Mercy's minimum requirements to stay as a 5-year, you have a spot in grad school. Yes, I think most PA programs focus a lot on primary care. So, internal medicine and family medicine rotations are not typically that hard to come by. Can I repeat the part? Yes, ask PA schools. If you are someone who cannot move around during clinical rotations, like you need to be in a fixed place, you can't move out of state for any given amount of time, you want to ask PA schools if their rotations are in state or within like a certain radius, or if they actually put you out of state, because I know of some programs that will actually move you all around the country. There is not a DO version of a PA. Yeah, the 5-year direct programs are typically only, you apply to them as a senior in high school, at least with mine. It is my pleasure, Amanda. Thank you for being here. Traditional PA programs may say that their requirement is 500, but at least the ones around this area, you need to, most people have well over 1,000. My pleasure, Kelsey. And doing 5 years is the same. So it's not because your undergraduate degree, Patricia, is typically 4 years. And so when you're a 5-year PA, it's 3 years only. But, you know, some people may move at more of an accelerated rate. No problem, Anita. I don't know, Catherine, if you could do the 5-year direct program online. Mercy isn't like that, though. Ugh. My problem, Jennifer. No problem, Leslie. Thank you for being a part of this. Guys, I don't know about this quiz thing, but I'm sure they'll come on here and kind of explain. My pleasure. Thank you guys for listening to the lecture and the rant. I hope this was helpful.
Let's jump in there.
My pleasure, guys.
All right, Leanna, do you have any, I guess I just want to make sure we're being respectful of your time. It looks like it's kind of winding down a little bit. Do you have any closing comments for us, or do you want to hang out and take more questions, or how, it's totally up to you.
I can do whatever you got. I have nothing, you know, nothing going on this Friday evening, so I can sit here and we'll kind of see if it dies down, but you're all welcome. It was my pleasure.
Okay, incredible. So we'll be right here. Just let us know whenever you're ready, okay?
I think they're all wondering about this quiz. I don't know how this works.
Yeah, so, very sorry about that. But guys, we always post the quiz after the session is over. The reason that we do that is so that we don't distract from the session. So we want to make sure that we're being respectful of the presenter here. We don't want to make it seem like we're just here for the quiz or certificate or anything like that. So please, please, in the future, refrain from asking stuff like that. I'll tell you every time in the beginning and in the end that we always do it at the end after it's over. Sorry about that, Leanna.
You're totally fine. I mean, I was curious too. I'm like, guys, I don't know where this quiz is, but you know, I'm not ignoring you. But
right.
Guys, it's my pleasure. I think for the most part, it looks like they're probably good to go. They're very eager to take this quiz.
I mean, I guess so, but yeah, well, thank you so much for this. I did write so many notes down as you were going through that, just to briefly go over it. Man, you were so incredible. Like, the information was amazing. So many good images. You're such a good teacher, really.
Thank you.
Yeah, that analogy. Yeah, definitely. Because like
that analogy for anyone who's going into this specialty, it's the only thing that makes sense to patients. Like, it's just the best thing I've learned. And yeah, thank you for appreciating it.
Definitely. It's a great way of visualizing that. And just thank you in general for bringing awareness to, I feel like, an underrepresented topic, you know. And what better time than Women's History Month. I didn't even
I know. We didn't even plan that. I don't
it kind of worked out, right? But yeah, so I want to reiterate that you're doing this at no benefit to yourself. So that's kind of the takeaway that we always want to kind of leave you guys with, is that all of our presenters, Leanna of course included, are doing this just to help you guys because they've been in your shoes before. It's a very like charitable and selfless thing to do. So just keep that in the back of your mind. We know you're all going to be PAs or healthcare or whatever you do. So one day down the line, hopefully you can share the same sentiment. So we really appreciate you doing this, sincerely. It means a lot.
It's my pleasure. And thank you guys for creating such an amazing page and platform for the pre-PAs to be able to get these certificates, because I mean, I've told so many pre-PA students about this page and they're just in awe because of the fact that with COVID, like, this is the site to be on. Because there's just no other way for students to be able to shadow nowadays. So I think it's great what you two are doing, and you're really making a difference, you know, with them. So we love it.
That means so much. Well, we really respect you, and hearing such kind words from you means a lot to us. So thank you so much.
Absolutely. It's my pleasure.
Well, it's really been an honor.
Thank you.
yeah, is there anything else you want to share with us?
Nope. I just wish you all the best of luck, and I'm here for anyone if they need me. And just remember that, I think the biggest takeaway is, just do what you love to do and don't get so caught up in, small things like a number, like a GPA, because, you learn from it and you grow from it. And it's better to have those struggles in undergrad, because then PA school will just kind of be a breeze.
Right. Yeah,
Oh,
absolutely.
yeah.
And thanks for sharing your personal story.
Oh yeah, no problem.
There's like 350 plus people here, and you're talking about these very personal things. So that transparency, it means a lot, because
For sure.
kind of when you're a student looking in from the outside, it seems like everybody's so put together and they know what's going on. They've got their life figured out, but it's not always like that, right?
Absolutely. And even when I was, in my first semester, when I got put on probation, none of the other friends I had were put on probation all the other 5 years. And it just I kind of hit that low point where I was like, I don't even think I could beat this. I was never, very math oriented or very strong in the sciences, but my goal, like what I wanted to do with my life, was the same as those people.
Right.
And that's what made me stand out more than most of them, is the fact that my background was just so different. So yeah.
Definitely. Well, we understand that every person is like a unique individual. Everybody has their own strengths.
Yeah, absolutely. So there's no one that can't do it. That's the whole thing with the diversity, is there isn't a model PA student. It's just
Right.
so all over the place.
Right. And there's the kind of the thing with the CASPA and the way that the process is set up is everybody is looking at it like it's a checklist, like get X amount of PCE, get
Yeah.
X GPA, get this, right? But that's not the case. Everybody's going to be a little bit different and everything balances out. I really liked how you mentioned that you turned what many would look at as maybe your weakest point, your low GPA, into a selling point for you, right?
Exactly.
That became, you kind of flipped the script on it and made it like, well, I overcame this adversity and here I am now. And speaking of here you are now, look at you now, right?
Yeah.
So
I know.
well, thank you so much again. We
My
really appreciate
pleasure.
you spending your what is this, Friday night with us, just hanging
Love
out.
it. It was super fun. Thank you guys for having me.
Yeah, absolutely. You're invited back
Definitely.
anytime.
Love that. You
yeah.
tell me when.
Well, have a wonderful night. Thank you so much again.
You too. Have a good night, guys.
All right,
Thank you.
take care. Okay, everybody. Fantastic session. Thank you so much for you guys as well spending your Friday night with us. Sorry, I just want to say one more time, please don't ask for the quiz during the session. It's kind of like, you're giving a presentation and then somebody's saying like, hey, when are you done? It's just such a, we don't want to do that kind of stuff. And I love you guys, and I know this community is amazing. I've seen through the chat, I've seen through all of the DMs we get on Instagram and all the emails that we get that you guys are awesome. This isn't like the cutthroat competitive stuff. We don't look at each other as competition. We look at each other as peers. So we want to do the best and, kind of maintain our character through this. And I know that's how you guys are, but yeah, so we are going to go ahead and post the quiz right now. Same usual thing, just get 4 out of 5 correct. It's nothing tricky. We just want to make sure that you're here paying attention. Ollie is working on it right now. You will get your certificate emailed to you within a week. If a week goes by, we ask that you give us at least 1 week before you start reaching out to us, just because there are quite a few of these to send out. If you have any issues or anything like that, then of course reach out to us. We are trying to fill up our March. As of right now, we have 3 out of the 4 weeks done. We may take 1 week off this month, but stay posted on our Instagram. We'll let you know. We are going to end with an OB-GYN as well, just in honor of Women's History Month. But yeah, so let's see. The session was about 1.5 hours, so we'll put that on the certificate. Yeah, guys, just want to thank you one more time. Quiz is going to be in the chat. We'll be hanging out in the chat as well. If there's any issues, just let us know. Thank you so much. You're all awesome. Be confident. Be, happy. But yeah, guys, this is us signing off, right?
Yeah. Okay. So I just linked the quiz in the chat. And it's pinned at the top in blue. So if the chat kind of scrolls and you miss it, it's going to be pinned at the very top in that little blue box. And you have an hour to complete it. So at 7:37 Central, it'll close. Yeah, let's see. Oh, and if it does that same thing as last time where it closes, just try refreshing the page because we will work on getting that back up as soon as possible.
All right, perfect, guys. Like we said, we're still in the chat right here. If you guys have any questions or any issues, just let us know. All right. Well, thanks so much again, and y'all have a great night. Take care.
Good night.